Welcome to Sex Care is Self-Care, a conversation on women's sexual health brought to you by the She Plus Foundation. I'm your host, Patty Brisben. I'm coming with I shouldn't say this, it's like you don't point out your favorite kids, but two of my very, very special favorite members of the She Plus Medical Advisory Board, Dr. Vaccaro and Dr. Iglesia. Now, you guys have been on the podcast many, many, many times, but I know that there's probably new listeners out there right now who are saying, okay, this is the first time I listen. Who are they? What do you do? Dr. Iglesia, can we start with you? What do you do on a daily basis?
Well, that's what you could say that we're your favorite urogynecologist, since we are the only two double board certified OBGYN and subspecialty trained urogynecologists in the group and on your board. So yeah, I'm a professor of OBGYN and urology at Georgetown University School of Medicine, and I'm the director for urogynecology for MedStar Health, which is a big health system in the DMV, District of Columbia, Maryland, and Virginia area.
Yeah. And I live just down the street from Dr. Iglesia, also a urogynecologist, as she already said. And I practice, in addition to urogynecology, sexual medicine in a private practice in Bethesda, and still I'm actively teaching at the Uniformed Services University in Bethesda as an associate professor.
So she's triple certified.
I don't know about that. There's no certification for that. It's just,
I just want to say thank you both for all that you do and all that you give back to women. Just taking time out of your busy schedules to join us here at the She Plus Foundation, helping to educate women. I know that I'm extremely appreciative, and I say this a lot, but I do pinch myself that I have such amazing physicians that set our board here at the She Plus Foundation. So thank you so much for everything that you do. I know that people are sitting here wanting to get started, so I'm sure that you see patients anywhere from 18 to maybe 100. I don't know. Right now, I want to see what the temperature's like with the patients that you're seeing. I know that I wake up and I'm scared for my own granddaughters. You know, I have more rights than they have, and that they have currently right now. How are your patients feeling? Are they opening up? Are they speaking to you? Are they talking about these things?
I'll jump in there, Patty. I would say, and I think Cheryl will back me up on this, in the DC area, there is a significant feeling of uneasiness around women's health and reproductive rights. Starting in January, my patients were all wanting to come in to get long-acting reversible contraceptives because they weren't sure if they would still be here. They were worried about, even some of my patients I'm treating for menopause symptoms are worried just about their menopause hormone therapies. I think there's just a general feeling of uneasiness because of so many changes that have come down the pike. And then I would say, again, because we're in the DC area and that's where a lot of federal employees are, a lot of our patients have lost their jobs, and that's really hard. I think the anxiety levels have also gone through the roof. Whenever I ask patients, how's your stress? It's almost like it's almost a rhetorical question, because everyone's like, well, it's super high, and then they kind of go into the details. So I think I'll let Dr. Iglesia speak as well, but I think it's just this very heavy general uneasiness right now.
Yeah. Patty, I mean, we talked about this even post-Dobbs, and we thought that was bad after the Dobbs ruling. And I think that's actually impacted a lot of medical education in terms of some of the restricted states. People think, even students and residents, when they're looking for training, where to go, if you're in a restrictive state and something should happen. So that goes through the mind and people making decisions about where to train. But with regards to patients, it's really honestly next level, Patty. I mean, not only within the first few days of the current administration, do we have like just complete chaos in terms of some of the guidelines that are federal guidelines, like how to treat herpes and stuff? You couldn't find it because like stuff was shut down. Fortunately, that has been reinstituted, but there seems to just overall be an attack on evidence-based medicine, a lot of information, misinformation, particularly with regards to like vaccines, but even on a personal level, on a day-to-day level, and what Dr. Vaccaro was talking about, it's next level for our patients. I have a specific patient that I was just seeing a couple weeks ago, and we've been carrying her through her pregnancy, which was a high-risk pregnancy, first baby. She had had congenital bladder issues, so we had said that she would get an elective C-section. On the day of her C-section, she got the notice that her health insurance from USAID was cut. Now, if she had gotten that email, which was by email, the day before, I mean, she would have had to pay for all that care because she had no coverage and she was the main insurer. And she said, since she had it on the day, she at least has insurance and FMA coverage for the next 4 months. But when I thought about that, I said, how is that even fair? How is that even just that you would even be thinking, about something like that, which should be one of the happiest days in your life, right?
Should be.
So, and I will multiply that, 10, 20 times in a week of what we're hearing. So
I'm sure that you're
next
seeing
level.
insurance-wise things being approved, but then turning back around and saying, no, just kidding, not really approved. Because I've had it happen to me.
Mm.
So
Yeah.
right now, I know that listening to what's going online and reading the headlines, how is it that every day you're waking up, keeping the hope, and helping your patients through all this chaos?
Okay, I'll start again. So Patty, I'm always a glass half full, find the silver lining, keep the joy type of person. So I really have to focus and hunt the good stuff, so to speak. So I'm going to share all the things that keep me going, that I find empowering and invigorating, because people do have the power to change things, and grassroots efforts and nonprofits and even social media can really change policy and move things forward. So I'm just going to highlight, I think, one of the most powerful and pertinent examples, which it was when the Supreme Court struck down Roe v. Wade, and now we're in post-Dobbs. Many states put together legislation to provide additional protection. So at the state level, the voters made it clear what they wanted. And I think, not that I prefer a federal level action, but again, that is supporting reproductive rights. But at least at the state level, a lot of women and men put their votes together and were able to protect reproductive rights. So that's one example. Number two is a grassroots effort in social media called the Citizens Guide to Menopause Advocacy. And this was like a collective voice driving change in women's health. So now 1 out of 4 states have proposed legislation to support menopause initiatives, which again, menopause for a long time had no one wanted to even say the word. It was like something you don't even talk about. And now it's not just even having a moment, but it's fueling a moment. And now it's a thing to watch in legislation for 2025. So this is huge progress for menopause healthcare for women. Sadly, in the DMV, we're not one of those states, neither Maryland or Virginia, but so we have some work to do ourselves. And then there's other organizations that are nonprofit, like one in our area called Tight Lipped, and it's a small organization, but making huge impact. And of course, we get to talk on and on about what She Plus is doing, but I think there's so many organizations that anyone can donate to, participate in, to help move the needle. Dr. Iglesia, what pearls do you? Oh, sorry, one more really big one that came out today. Today, there was a 6-year advocacy effort that is now endorsed by the American Urologic Society, American Urogynecologic Society, and the Society for Female Urology, and endorsed by ISWISH and the Menopause Society, which is a joint guideline statement on how to treat the genital urinary syndrome of menopause. This is huge. It supports local vaginal estrogens, supports non-hormonal options, endorses the safety of vaginal hormones in women that have had a history of breast cancer. A very strong joint public statement. So, and that was actually released today. And again, that was a 6-year kind of advocacy effort. So
Awesome.
lots of good things are coming down the pipe.
Yeah,
Dr.
there you go.
Iglesia, you have to share.
Yeah, there's hope. For me, being in academic medicine as faculty at Georgetown, I every day get to interact with the future of medicine and particularly of OBGYN with the students, the residents, and the fellows. And they really keep me going. I mean, in fact, next month is going to be a turnover because we have all the graduation. But today was bittersweet because I operated with my senior fellow, probably for the last time as a fellow. And it was just me and her and a student, but she and I were doing this case and, it was just like mastery. And, when you see that click and, this case is huge, I'm talking huge prolapse, and we did it in 2 hours, not a glitch, not even a tablespoon of blood loss. It was magical. And that really that's really helpful. But, from a policy point of view, I want to feel like there might be some help with regards to physician payment reform. And tomorrow I happen to be going to the Hill to work with some of my colleagues as we meet with some of the Congress people about payment reform for women's procedures and the RVUs. So Jocelyn Fitzgerald's coming on board. She's
Amazing.
a big social media presence. And Louise Perkins King. And so they have a huge thing. And I'm very excited that we have people, energy. Jocelyn's a former fellow as well. So I think that's coming down the pipe because honestly, there hasn't been a lot. And obviously there is, with any industry, there's always fraud, waste, and abuse. And I understand that. But what I'm concerned about is that if we do this kind of like this way, without being more surgical about it, that there are going to be people who are going to fall through the cracks and who really need some of these subsidies, and they may be Medicare, but they're very vulnerable. And I worry about some of that stuff, like really, like lose sleep kind of worry, for those folks, because, that's not what America's made of,
Right. But just seeing how excited you are with your fellow and
Yeah.
and where she started and where she landed. I mean, that's, I'm happy to see that and hear that.
Big skills.
Thank you for
Big-
sharing. So, Dr. Iglesia, you're a surgeon. How dramatically is access to life-changing and life-saving care like you provide being impacted right now?
Yeah. I think it's concerning. It's dramatic. As I said, you just recently had a woman who worked at NIH. And she's like, you got to do my surgery as soon as possible, Dr. Iglesia. Get me on the schedule because I'm not sure if I'm still going to have a job in the next few weeks because they've already cut a lot of people in my department. Well, that's terrible that you have to, be like that and kind of like press, so we're operating 12 hours a day and doing all this stuff. But it does get back to this issue in our country, which is the greatest country on earth, but our lack of universal health insurance is a huge issue, and that it has to be tied to a job. And then, for some people, being tied to a job, you cannot change, because you cannot not have insurance. But I worry that there'll be higher co-pays, there'll be higher deductibles, there'll be a lot of services, like, I don't know, you experienced, that will no longer be covered services. And, that's what happened. So I applaud the need, and I understand that because I feel like there is some fraud, waste, and abuse that needs to be addressed. But I think we have to do it a little bit more surgically specific to certain programs. So I don't know. Big problem, but it's going to take some big thinkers, I think, to solve this.
Dr. Vaccaro, do you have anything to add to that?
I agree with everything Cheryl said. And I think, again, I've heard the same things from my patients, really worried about their healthcare coverage, worried about their jobs, worried about their families and how they're going to support themselves. Even just in my neighborhood, we've started, collecting donations for certain families just because, both adults in the household don't have jobs. So it's pretty it's hard sometimes to find that silver lining if you're the one who's had a job in a government organization that you think is safe, and you take this government service job because it's it doesn't pay the best, but it's safe, and then you get 15, 20 years in and then you get cut. That's hard. It's a hard pill to swallow. And so I think our communities are suffering right now, and that leads over to healthcare.
I know we started this podcast today at 5 Eastern Standard Time because you guys are in the operating room until late because you have so many requests. And is there other things that are affecting your ability to provide care for these patients?
Yeah, I mean, I think overall, I'm more concerned. I mean, we're kind of tertiary, so like they're pretty serious conditions. And in general, the stuff that I do is covered by insurance when you're talking about, reconstructive surgery or damage caused by childbirth and stuff like that. But I'm actually more concerned for preventative care in our country, access to birth control, access to the nutrition and medicines that we use for prevention of serious illnesses. I think we're going to have some issues. Obviously, the uninsured, but beyond the uninsured, and here in DC, this is not a small problem. We have people that will show up on our doors who literally are undocumented. So we have to still take care of these people. And that's so much anxiety, whether it be for pregnancy or whatever, and we've had a lot of training specific to this. There's concerns if ICE were to come in and whatnot. And it's even so hard to think that I'd even have to be concerned about something like that when really what we're trying to do is like provide the best care. So, I mean, we have some guidance. There's some rules. You can't interact in the middle of, a medical intervention, stuff like that. But I know it weighs on the mind of a lot of people, who are really just trying to do a good job, the best they can with what they've got. But they're scared even to go out or even have their children go out. That's not that's not the way it should be.
And I'm just going to tag on to that about preventative health. I mean, again, I think, these Title X funds that have been frozen, that's like 35 million, we save money by prevention. Our country actually saves money by preventing certain cancers with an HPV vaccine, by preventing pregnancy, right? By giving medication to patients that need it for pregnancy prevention, to provide basic STI screenings and treatments, basic cervical cancer screening. All these things are actually cost savings, but when we don't give them or don't have the ability to provide prevention, then it leads to more cost to our society. So it's like it doesn't actually even make sense monetarily, and it actually hurts our community. So that bothers me a lot.
So, Dr. Vaccaro, I have been keeping up with you on Instagram. Thank you for everything you're putting out there. I've been loving your Urine Luck series. Can you talk about this to the audience listening so maybe they can tune in and find out more?
Yes, I love, it's so fun, and it's fun to have a catchy slogan. That was Chat GPT, by the way. It's like, how do you make a catchy slogan about urinary symptoms? And anyway, so I decided to do this because urinary symptoms, most women find them embarrassing. They sometimes don't speak up to their doctor. But when they're educated and empowered and they know that there's treatments out there for all sorts of urinary symptoms. So what I'm talking about in this current series, which is going to be 30 days, is everything about the different kinds of urinary leakage. So urgency and stress incontinence. These are things that Dr. Iglesia treat every day. Chronic UTIs, which is a huge problem with women, bladder pain syndrome, just basically any symptom you can imagine related to the genitourinary system, I'm going to be talking about. And And again, a lot of these have to do with hormonal changes that occur during menopause. So again, it's just destigmatizing, educating through empowerment, giving women tools. And again, social media can be a really powerful tool if we put out really good information, so that women feel, again, like they can advocate for themselves. So I've been really enjoying it. And actually, I have sitting here right next to me, I'm going to talk about bladder Botox today. And here's my cystoscope for my reel later today.
There you go.
Bladder Botox, it's not just for your face.
So what?
Botox, not just for your face. Bladder Botox is not for your face, it's for your bladder.
There you go. Let me ask you, what percentage of women suffer with urinary incontinence?
Yeah.
Is there, what would you say the percentage is?
At least 33%, at least.
But more as you age. By the time you're 80, it's probably 50%.
Yeah. And for women that, it's leakage when they cough and sneeze is about 1 out of 3, but just like Dr. Iglesia said, as we age, it's more common because of the genital urinary syndrome, especially that it's not treated. So very common, extremely common. So
Thank you.
Should not be something that we don't talk about.
You walk in the aisles at whether you're at Walmart, Target, whatever, and you see those Depends, and they're there. And so, and I know it's, again, a shameful subject. It doesn't happen to me. It's not me, but I've heard some of my friends talk about it. It happens to a lot of us.
Patty, it's $1 billion business, the
Yeah.
pad business. And that's just for incontinence. We're not talking about menstrual products. We're just talking about incontinence products.
Yeah.
Billions of dollars. So Dr. Iglesia and I both, I know we're on the same page here, where our goal is to get people out of pads and incontinence products. So.
There you go. So why do you think that doing these Instagram, these like mini talks online, do you think they really do help? I do, but I want to hear your take on it.
Yes, it's funny. I have for some reason, I have a huge following in Australia. It's crazy how these algorithms work and how things get shared. And I have a lot of patients that come to me and say, I saw you on Instagram and I wanted to come hear from you because I think now you're the expert, right? It's interesting how social media gets spread, how algorithms work, how people search for things, and then they find, different answers. Am I saying everything on social media is accurate? Absolutely not. But as one of my colleagues said, if we're not, as the experts, as professors in our craft, giving good information, then all that's out there is maybe dis or misinformation. So that helps me continue to do things at night or on the weekends to better help women.
I love watching these. I probably spend too much time watching them, but I love when other doctors go on and correct people who say they are, but they're not really docs. And yep. I think it's great. I think that should be brought to the forefront, because if people are taking some of that serious, people ask me all the time, who do you follow? And of course, I have my laundry list of who I follow and why. And I'm sure that the She Plus Foundation has it up on our site. Bree's shaking her head yes, because I want people who come to us following the right people and not just people who are blowing wind, smoke, whatever you want to call it. How has the decrease in funding impacted you and your patient services? Has it? Do you see it now? Dr. Vaccaro, let's start with you.
I haven't seen it personally because I'm in a little bit of I'm not in an insurance model, so my patient population is a little bit skewed. So I will actually defer this to Dr. Iglesia.
Okay.
I know. I think a lot of academic institutions, Harvard, Hopkins, here at MedStar, Georgetown, we're all concerned about the decrease in funding, the percentage of a lot of big academic centers of money that comes for research, education from federal dollars is significant. And it's even more significant if it has to deal with women's health, DI, God forbid you should use the word pelvic,
Mhm.
on that. It seems like that they are all worried about cuts in funding. And the way that will trickle down is it also just trickles down into way hospitals and physicians are reimbursed by specialties. So, like cardiac, um, ortho, neuro, vascular, and to some degree oncology, like really more male dominated surgical subspecialties get reimbursed at higher rates. And what that means is that when you're allocating the resources like OR time and you're you know and in the C-suite, you're more likely to give those key OR rooms and times to the specialties that have higher remuneration, not women's health. And that's what we're seeing just in terms of like block time, in terms of like allocation of resources, whether it be another APP, nurse practitioner, medical scribe, administrative person. It makes sense. It makes sense economically. I understand hospitals have bottom lines and the margins are, and I get it. But from an emotional point of view, from what we do and what we feel that we do our best job trying to help women, it's a hard pill to swallow, I have to say.
Yeah. If access to care is limited, how does the average patient, how do they take care of themselves? I mean, do you have advice to give them?
I struggle with this, Patty. I really do.
I know. Me too.
I don't have a good answer for people other than they just have to continue advocating and finding providers and teams that they feel that listen to them and provide good care. But it's getting harder and harder, this idea. And again, the reason I left the insurance model where I felt like I couldn't give my time and educate patients is because this idea of moral injury, where doctors feel like they can't provide really good care in a short amount of time, and patients feel like they can't get their questions answered in a short amount of time. So it's like everyone's losing. The patient feels like they weren't heard, and the provider, who's only wanted to go into medicine to help people, feels like they can't adequately give good information because the time is limited. And so it gets into working really late after hours and messaging patients after hours, and really the physicians get burnt out.
Yeah.
And that's not good either. So I don't have the right answer. I had to make a personal decision for myself to leave that system because all of my colleagues were suffering, and I didn't want to do that to myself. But it's a really difficult question. I don't have an answer. Maybe Dr. Iglesia has a better answer.
Yeah, well, first of all, I admire all those who are providing a lot of reliable patient information like you, Christine, and the She Plus Foundation for patients, because access is really limited. I mean, to get appointments with someone like myself or any of my partners, it's weeks or months, if not months. It's not unusual for me to hear, I waited 6 months for this appointment, doctor. I feel like I need to do a song and dance like it's a Broadway show. Before you're coming in. But the bottom line, I do hear people get on wait lists. If there's a cancellation, the squeaky wheel.
Yeah.
It's like, oh, you got in, and it's a terrible thing that you have to do that. But in insurance, in the way insurance works, that's what it is. There's not limited resources. It's a problem. So taking care for yourself, educating yourself too much, getting second opinions if something doesn't feel quite right, trying to be a little bit patient. But I do not have a good answer. I mean, if I had unlimited resources, we'd see everybody within 3 days of when they were brave enough to call to ask for a consultation.
Yeah.
It's just not possible.
Just the only thing that I can say here is that they just got to keep advocating for themselves.
Exactly.
That's about it. I know, wasn't this year, but last year, I was invited to the Society for Gynecologic Surgeons. I'm going to tell you, I don't follow anybody. I think Cher would be the only one that I would just, because I think she's amazing. But when I was invited to come to this, I mean, I walked in and all of you are rock stars. You know, I stood there while people wanted to come up and speak to you, talk to you, pick your brain. I listened to you speak to doctors that are up and coming, and it was amazing. And then when I heard the She Plus Foundation being announced on some studies, that was a big moment for me and for everything that we here at She Plus has worked so hard on. I know that we had a grant a project that was presented in March. Can you tell our listeners a little bit about
Yeah,
that study, please?
I can tell you a little bit about, I mean, this was a full oral presentation on the first day. It was oral presentation number 3. It's published, and I'll make sure I give Bree the link so you can see the published abstract. It's going to be probably that's the abstract and the presentation. And then the full paper is in probably in press. But this was called the post-op return to sexual activity, or the PORS study. So after surgery, whether it be hysterectomy or surgery for prolapse, surgery for incontinence, there's a usual way that people say, oh yeah, just nothing in the vagina for 6 weeks, blah, blah, blah. And then there's enhanced counseling about how you would re-engage in sexual activity after surgery. And this was in 11 sites and had nearly 200 patients. Let's see, 186 to be exact. And they followed for 6 months until patients, first had sex. And it turned out, kind of makes sense, that those who had the enhanced counseling, more talk about what to expect, had better sexual outcomes, less pain. And actually, a lot of people had returned to sex even before the 6 to 8 week mark, which we normally say to them to do. So to some degree, I mean, this is new information that was funded by the She Plus Foundation, which we hope will become the more standardized approach, not assuming on your post-op visit that and actually another time is like postpartum. We don't talk a lot about some of these practical things. It seems so simple, yet people are silent about it. If you don't ask about it, I'm not going to talk about it. I don't have that much time. You don't have that much time, blah, blah, blah. It'll happen when it happens and you'll figure it out. No, there's a better way. Your foundation has supported this enhanced counseling. And once this is published, I'm really very proud of the group. This is part of the Collaborative Research in Pelvic Surgery group. It's an arm of mostly like young attendings, or like 5 years or so out of fellowship, who rapidly got this project together. So that's just one of the many, and there's a couple more. You want to talk about them too, Christine?
I can share about the one that I was involved with, which is the Volby study. And this is a study, it was 10 different sites looking at fractional CO2 laser for lichen sclerosis, which is a vulvar skin condition. And we are done collecting. We are in the analysis phase. We'll be presenting soon. So more to come on that. But again, just going to say that none of these studies, because they're about women's sexual health, would have been funded without the She Plus Foundation. It's just, we are literally through this foundation moving women's health forward. Again, we don't have unlimited funds, but I think we're making clinical, meaningful change. And I'll just, for the PORS study, I mean, again, I've been in practice for 20 years, and it's like, we're literally we're doing surgery on the vagina, but then we're not giving women any counseling about when to start using their vagina after surgery. It's kind of crazy, but we needed this study. We need to do more counseling like this and have a standardized approach. And I love that this study was a full in the spotlight oral presentation at SGS. I just love it.
I think it's.
And there's another one, Patty, hot off the press, that I just texted you about. This one was from my other fellow, because you have 2 fellows every other year, Bailey Clark. She just presented this for her fellowship thesis. So it was the VIP study, which was a randomized trial funded by Patty Brisben, looking at PRP, what's also known as platelet-rich plasma. People use it in ortho in the joints and the skin and in the hair for hair loss. They use it for those vampire facials. Anyway, it's been talked about for sexual enhancement.
Mm-hmm.
So we did a randomized trial. It was a pilot study of 26 patients who got PRP injected into the vagina and anterovaginal wall, quote unquote, G-spot, and 26 who had placebo, a saline injection. And it turns out there was some positive response to the platelet-rich plasma, which, we're going to talk about once this has been fully presented. But we did the preliminary data. And the other thing which I can say is that she actually just won first place. It's going to be presented on May 19th, but here at MedStar for her, like the whole system-wide, 9 hospitals funded by the She Plus Foundation. So she got, because it's such a novel study and the first of its kind. All you have is maybe 4 papers on PRP and sexual and in the vagina, most of which are very small and limited follow-up, but no trial to this level of, the highest level of evidence in randomized trials. So
that's what I'm saying. Rock stars. Yeah, I mean, rock stars. You guys are the ones that I would want to follow, because you're the ones that's going to improve this generation and generations to follow. So, thank you for your hard work and your dedication to the women's sexual health. I always end by asking, is there anything I forgot? Is there anything that you want to speak about before we say?
I have a couple things to say, Patty, and I think sometimes we think that we can't do anything to move the needle as an individual, but all of our collective efforts, little tiny efforts, do move the needle. So if you're like, what am I going to do as an individual? I just got an email from the ACOG, which is American College of OBGYN Advocacy Department, just today about things that we can do, and just sent another letter to my congressperson, but they're looking for letters from everyone, not just from physicians, but from patients. So please take a moment. If there's something that you want to say to your congressperson, email them. That's their job. Their job is to take your ideas, your concerns, and synthesize those. And the more you do that, the more they understand what their governance, their collective constituents want. So you can email them, you can call them, you can sign up for flyers and be a part of advocacy efforts, because little efforts do add up to big efforts. So I'll just leave it at that.
Thank you. We'll put that out there.
And I have a QR code actually for patients that I just got sent to, so I might email that to Bree, and maybe we could post it on socials too.
Perfect. Any way that we can get this messaging out helps.
And I would just say that, having just come back from a vacation, I have like books on my mind. And I actually read several books, including several related to sex and perimenopausal sex. One was All Fours by Miranda July. Have you read that one?
I haven't. Was it good?
A lot of sex. And it involves a Hertz driver, a Hertz worker. And the other one was The Safe Keep. So The Safe Keep won the Booker Prize by Yael Vanderwoder. She's it's a post-World War II. Lots of sex, but these are good storytellers. So anyway.
I'd love a good storyteller.
Yes.
I'll have to look into this.
The Safe Keep. Yeah.
The Safe Keep. I remember that. I always love seeing your faces. I always love having our visits, our talks. You bring so much to the table for so many others. So I want to say thank you so much for joining. I know you're busy right now. I know you have like a ton of things going on in your own practices, but thank you for giving back to us. I appreciate you so much. If you like what you heard, please rate and subscribe to our podcast. For more information on the She Plus Foundation, go to www.sheplusfoundation.com. Remember, sex care is self-care, and sexual health matters.